day, everyone. This is Dr. Yvette. I'm a nurse for 30 years, and I'm here. I'm so honored to have our guest again, Dr. Saeed Raza, all the way from across the world. And thank you, Dr. Raza, for gracing our show again. We are propagating and really passionate about heart disease. And here's a very big expert of our day, renowned not only a cardiologist, but also a philanthropist who's always been propagating the word on heart disease and how to prevent it and how to save lives. So without further ado, here's Dr. Saeed Raza. Thank you, sir, for gracing our show.
Thank you so much, Yvotte, for inviting me on your show, and a very good evening from Bahrain. We are in two different time zones. I believe it's morning in New York, in USA.
Yes.
So it's 7 p.m. in Bahrain. So very good evening to you.
Welcome. Thank you, sir. So tell us about your most passionate. I know heart disease and the heart alone has so many topics that can stem from it, but tell us what is the deepest concern that you have for us these days and, your recommendations.
Well, Yvotte, as you know, the World Heart Day is, few days to go on the 29th of September. That is the day we commemorate World Heart Day. And the whole idea is to increase the awareness of heart health, not only amongst the physicians, but also amongst the general public and patients. And I am quite passionate about preventing heart diseases and particularly sudden cardiac death. And as you know, sudden cardiac death is something that we do not have, first of all, very clear figures from this part of the world. But there are statistics that it is quite prevalent, although it is underreported. So my drive for this year's World Heart Day will be to increase awareness about sudden cardiac death, and also a related objective is to increase awareness about cardiac screening. That means, everyone should get their get their heart checked, so that they are not at risk of sudden cardiac death.
Yes, sir. Thank you. So tell us a little bit more what is involved in that screening. So for me, as a medical professional, I would know a little bit about it, but for the general public, what would be the very first, the very first step?
Sure. So first, let me give you a little bit of background. So essentially, cardiovascular disease, as you know, is a very common problem, and it accounts for almost 20 million deaths every year. And out of these, about a quarter of the patients, that means approximately 5 million, will drop dead suddenly. And these are figures from the United States that nearly 1,000 individuals, they do drop dead suddenly per day. Yes, 1,000 individuals do drop dead suddenly per day in the United States alone. So you can imagine the scale of the problem is quite high. Now, these figures are not very well reported from different parts of the world. And you may hear or see these sudden cardiac deaths on television, newspapers, but these are just the celebrities. I know some famous personalities, maybe athlete, footballer, but there are similar deaths happening all around us in our neighborhood. Maybe in one of your family members, your loved ones may have had a sudden cardiac death, but these are not reported, unfortunately. So sudden cardiac death, essentially, by definition, it is a death which is unexpected death, in which a person dies unexpectedly due to a heart condition. Now, when I say it is sudden, it is not often sudden. Now, there are some studies which have shown that these individuals may have had symptoms within the last 1 hour. So the World Health Organization gives the definition of sudden death that a person dies unexpectedly within 1 hour of certain symptoms. Now, these symptoms could be just simple as chest pain, dizziness, or a fainting symptom, or a palpitation and breathlessness. So these are some of the common symptoms they have.
Mhm.
Now, as I discussed that cardiac screening is one of the things that we do advocate, and that's something what I'm promoting this year, particularly on the eve of the World Heart Day that is coming up soon. So this is very, very simple, a screening method. So in what we really do in cardiac screening for these individuals is that we have a very, very brief consultation with the individual, and then we do very simple tests. And these tests are very simple. It's ECG, electrocardiogram, echocardiogram, and sometimes we may need to do some advanced tests for these individuals.
Yeah, well, thank you for elaborating. So I know, so checkups with your regular physician, then of course your cardiologist will help, and then history and background, of course, and then like you said, a simple EKG. Would stress tests be one of those things that are kind of routine?
Yeah, that's a good question. So, as I said, these are the basic tests, but we may do stress test for certain individuals, particularly where we feel that this individual may have future risk for developing a coronary artery disease. So,
Mm.
stress test will be helpful. And there are some other tests we do, like not in everyone, but where we feel that we need to study the structure of the heart in more detail, then we may go up to do a cardiac MRI and sometimes a CT scan of the heart. And also sometimes, that's a cardiac catheterization or coronary angiogram.
Mhm.
And one of the things, as I mentioned, that arrhythmia is a abnormality of the heart rhythm, as you understand. So if we need to investigate that in detail, then we may also make use of what we call Holter device, which is simply a machine, as you will know, that records the heart rhythm
Mhm.
for 24 hours. We may record for 48 hours, and there are no modern gadgets that can record even up to 6 weeks. And then so these are some of the investigation we may do, not in every individual, but in selected individuals.
Yes, thank you for that. I know with the advancement of science and technology, there are just so many resources, like what you have mentioned, Doctor. But it's interesting that the public are not really, they are aware, and like what we're doing here is increasing awareness, but they are not very big on going to their doctors. And that's why the reason probably that you guys are trying to increase awareness and with the gadgets that, like you're saying, it's not really invasive. It's just a cardiac screen and more follow-ups, like what you're saying about the monitoring that will take up to days and weeks and to study the heart. So maybe the public is always connotating the cardiac check to be very more invasive. That's why it has this negative connotation with it. So really, we are here to help promote this, and not because it's a scary thing, but it's actually to save lives. Just like what Dr. Raza was saying, it's a very sudden death, and it's hardly preventative. But when it happens, but when things like this, that you have time to have the background check on your health screening and other screening methods, then what is the comparison, doctor, when a person does the cardiac screening versus the person that hasn't really done their homework and go to the doctor?
Yeah, Yvotte, you raised a very good subject about patients' fear of
Yes.
seeing a doctor, and I don't know why the general public and patient they have a fear to see a doctor or come to a hospital. Now, this happens not only with the cardiac check or doing any tests related to heart, but in general, you'll see even if we discuss a very simple pill,
Mhm.
then the patient is afraid.
Yeah.
Now, I don't know the reason, but I believe that these patients, they need to be educated. And unless we do not educate them, we cannot gain their confidence. So I think we should aim as a healthcare professionals that we must educate the patients first so that they understand what we are talking about in terms of investigation or whatever treatment we are offering so that they become comfortable, they gain confidence in the healthcare professional. And then I'm sure that they will certainly agree for the tests. Now, the tests that I mentioned for cardiac screening. Now, see, cardiac screening does not need to be costly. And that's the motto of screening is that it has to be cheap because you're going to do these tests in a vast majority, a large population. So by and large, these tests have to be very cheap. They have got to be readily available. And these are very simple tests. So just a quick consultation, one ECG, and an echocardiogram. No painful procedures, no interventional procedures. So this is all non-invasive. So I think we need to discuss this very briefly with the general population that, these are the simple tests and there are no needles, nothing going in your vein or artery. And it's a very quick and cheap procedure. And the screening, a lot of voluntary organization like ours, we do it for free, of course. So there's no charges to the general public.
Well, thank you for that. And I know all over America too, they have these public and free screening, but thank you for what you're doing in your community, doctor. It's a huge help because for us, for medical professionals, it seems to be a very common knowledge having to say, oh yeah, of course, we know all the steps, but for the public, it's not really the most common knowledge. So they always have this conversation among themselves and they're non-medical usually, and they would say, oh no, my friend died from the surgery and it's not good to go to the hospital. And they have these cultural saying sometimes and notion that prevents them from seeing the doctor. So I guess the fear you said and the less knowledge about what they have is more power to them, which is actually the boomerang, which is the exact opposite that doesn't help them at all. So free is always a good avenue for them, but at the same time, I wonder sometimes education is huge, but it's a lot out there for people that still doesn't know. But programs like yours and services that are educating the public is huge.
Yeah, exactly. I think that's the word, education and increasing awareness. But the fear factor, I think that does play a crucial role.
Yeah.
Fear to drive the patient away from the hospital. As you said, somebody may have had a bad experience, not only with themselves, but some loved one of theirs. But again, the fear, if somebody has seen somebody dying suddenly outside, and that makes them fearful, and that will drive them to come to the hospital, not drive them away from the hospital.
Yeah.
So I've had patients who had, in the community or in their neighborhood or even in the office, some individuals who died suddenly, and then I see an influx of certain individuals from that group saying that, can we have our hearts checked as well? And so had happened in my office or in the neighborhood or in the school. I've seen that with, certain cases have happened in Bahrain. Unfortunately, a few young children, they have died suddenly. And so their parents got very concerned and got their kids to get their heart screened. So which I think is a good move, but the awareness should be spread in a different way, not after something has happened. Then we all need to work on preventing the life that is lost.
And you mentioned, doctor, among teens, the screening, did you say, is after 18? And I've heard so many horror stories among athletes. So you would say that exercise, of course, is always helpful. And just, of course, for the people that have been prescribed medications, to be very compliant with their medications and so on and so forth, lifestyle change. But what's more concerning to me are it's happening with more younger people. So tell us more about that.
Sure. So let me just explain that the sudden cardiac death can be divided into two groups of population. So one group are the older patients, and we have a cutoff, say around 35 years. And the people above 35 years, generally, they will have underlying coronary artery disease. They may have suffered a heart attack or they are at risk of developing one. So they will suffer a cardiac arrest due to a coronary artery disease, and which is the commonest cause of sudden cardiac death. On the other hand, the individuals who are less than 35 years, who could be teen children, very young children actually, and so they have a different problem. Of course, their coronary arteries are perfectly normal, but their problem may be either in their heart muscle, and either the heart muscle is very thick, that's what we call hypertrophic cardiomyopathy, or thickening of the heart muscle, or the heart muscle may be very weak, thin, and it balloons out, which is the dilated cardiomyopathy. And there are other types of cardiomyopathy. I don't want to go into detail. But the other problem may be some electrical abnormalities that these children may be born with. And so there is electrical malformation, and these patients may go into abnormal heart rhythm, which we call arrhythmia, and that may lead to sudden cardiac death. Third, abnormalities we may see in very young children, and this may go undiagnosed. And this has also been seen on further investigating the athletes, particularly, that they're born with abnormal coronary arteries, which they may not know about unless they stress themselves. They are engaging in sporting activities. And so these blood vessels, the abnormal blood vessels, which are called congenital coronary arteries, they get compromised. And that, in effect, can lead to heart attack, you can say, lack of supply of blood to the heart muscle. And that leads to arrhythmia, and that can lead to sudden cardiac death. So yes, all the teens and children, if we do suspect that, there's a family history particularly, or if they had any kind of symptoms, unexplained dizziness and fainting while exercising is an important one. And palpitation is another one. And the athletes, very similar symptoms, they kind of faint or become dizzy while playing, or if they get a palpitation or chest pain or get short of breath without any reason, then these individuals must be screened for as well. So family history, again, is very important. If somebody in the family died suddenly at a younger age, particularly, then the children must be screened for.
Wow, there's so many facets of one heart disease and heart prevention, not just only in the elderly, which is very common, but also in the anomalies among children and younger
Good.
population.
Yes.
So for symptoms, sometimes it's very much similar to what other symptoms are. Like for moms and busy moms, we always feel fainting. It's like, oh yeah, it's just probably a lack of sleep, right? Or maybe it's just exhaustion. But different presenting signs are also different among genetics or even male versus female manifestation of a heart attack or sudden death. So, do you mind elaborating on that, doctor, on the women's presentation of a heart attack may be different from the males?
Yeah, true. The women, they do present differently. And these are called atypical way of presenting or atypical symptoms.
Yes.
So they may sometimes present just with dizziness, as you said. Profuse sweating is another one. Sometimes, as we know that the pain or the angina, heart pain or the angina is in the center of the chest or the left side. So these women may present with a pain on the right side or in the arms. And I've seen a couple of patients presenting on the back. And these patients, they are sometimes missed or misdiagnosed as the bony problem, arthritic problem. But once they are investigated, it turns out it is heart disease. So they may have atypical symptoms. And not only women, there are other group of individuals like elderly patients. If the patient is older, and then they may present atypically. If they have got diabetes, then they may also have atypical presentation.
Wow, so much to look out for. As a medical professional in the family, I'm the only nurse in the family, and no one is a doctor. I'm always like trying to lecture or even like be morbid a little bit. Yeah, do this because if not, you do that. But I'd like your presentation, which is your approaches in a positive side, like having a free clinic, having more buy-in among your patients and the public, having more education and have established relationship, I think is a lot more successful than preaching to them. You have to go to your doctor. I think that's part of the problem too, because we try to scare our family and friends, and that gives the negative relationship among doctors, especially cardiologists. But thank you for your positive approach, doctor. Definitely, that helps better.
No, that's very true. I think we must make every effort to educate. Sometimes I do when I'm meeting them or my friends or relatives socially.
Yeah.
So I just kind of initiate a discussion that I make them aware, just make use of your presence there and educate them and just increase the awareness about heart health.
Yeah. You can never overly educate everyone about the heart health. I wish we can do more heart health, not just in a September, but also on a monthly basis. And I think we can prevent a lot more of the heart attacks. Some of them are non-preventable because of all the etiology or causes or backgrounds among family, predisposition. But a lot, I think, more is preventable. So, what's the statistics, doctor, on the prevention? When the person goes to the doctor regularly and having all this testing and follow up, taking their medication, how easy is it to prevent heart attacks versus the person that does not do their homework?
Right. I think it's not very difficult, as I said, getting the tests done. And of course, depending on what the underlying abnormalities we find. Now, if we are talking about older patients, then as I said, that coronary artery disease is the biggest risk factor.
Mhm.
And that may eventually lead to myocardial infarction. And then, if they do develop arrhythmia, then that would lead to sudden cardiac death. So once we pick these patients quite early, and if they have risk factors, then we have got to mitigate those risks and get the diabetes under control. If they are smoker, then let them stop smoking, control their blood pressure, control their diabetes, control their cholesterol, and of course, advocate a healthy lifestyle. And if they have some non-reversible factors, then unfortunately we cannot do anything. If they are born to a family which has got a high risk of premature coronary artery disease, then certainly there's nothing in our hand. But yes, again, we can prevent, we can give them medications to prevent. So these will be preventative measures. And if we find that patient has got underlying coronary artery disease which is established and that may give rise to a myocardial infarction, or any catastrophic event, then we can intervene. So these patients may undergo coronary angiography first of all, and then percutaneous angioplasty, and then putting a stent or surgery. So those things can be done. Now, the other ways to prevent, of course, is well, since we are discussing sudden cardiac death and cardiac arrest, which happens because of the malignant arrhythmia, which you will know is one of the ventricular fibrillation or pulseless ventricular tachycardia. So for that, these patients may be implanted with a device, which is implantable cardiac defibrillator, that can give them a shock if their heart do go into a chaotic abnormal rhythm called ventricular fibrillation or pulseless ventricular tachycardia, because that may be a catastrophic event to cause the death of the individual. So that is from the older patients. Younger patients, similarly, if we do find they have abnormalities of the coronary arteries, then they may be surgically corrected. If we find that they have got an abnormality in the heart rhythm, so now the electrophysiology has advanced, so they can make use of the radiofrequency ablation. They can burn certain electrical pathways. They may also have implantable cardiac defibrillator if the indication meets the criteria. So they may have those as well. So there are lots of things we can do to prevent the sudden cardiac death. But beyond that, beyond that, I always say it is the education, increasing the awareness, as simple as that.
Yes, we always boil down to the education. Thank you so much for that comprehensive interview, doctor. So, guess what? For all our public audience, we are just saying there's so much to do, but there's so much to prevent as well. We don't have to go through all the details of invasive procedures, but guess what? First step is education, seeing your doctor, and all these other things can be prevented. It's a serious consequence, but at the same time, on a happy note, it's a very preventable disease. So, to be respectful of your time, doctor, do you want to
So
have any?
I'll before you close, I think we have not touched one important part with I thought we will discuss this very, very briefly so
Please
that
do.
it becomes useful for the audience who are listening to this conversation.
Mhm.
Again, it comes in prevention. And my apologies, I should have included this, which is extremely, extremely important,
No worries.
is knowing cardiopulmonary resuscitation
Ah,
and use of automated external defibrillator. I think that's very, very crucial.
Yes.
And this is something, again, we are advocating. Recently, we did run a training program for the general public, uh, just uh, just teaching them very, very basic cardiopulmonary resuscitation and use of external defibrillator. Now, I always ask this question to the audience that, God forbidden, if you or your loved one ha has a cardiac arrest, which is outside the hospital,
Mhm.
so who is going to be the one, your savior, and who can save you? So obviously, it is not the top cardiologist in the town, but it's going to be the person next to you.
Yes.
But provided that person has got enough training
Yes.
in cardiopulmonary resuscitation and then use of external defibrillator. Now, these are again very, very simple skills to learn. General audience, thankfully, when we had our event recently, and within a short span of time, they could learn those skills. So, learning the cardiopulmonary resuscitation and use of external defibrillator. So, this is something we must promote. But I think where it starts is recognizing, first of all, that a cardiac arrest has happened. So that is step number one. So whenever a cardiac arrest happens, first the general public must recognize that this person has fainted or has collapsed and he is in cardiac arrest, which is again very simple, as just to see and check that patient is responding or not responding, then very quickly assess the breathing and then check for the pulse. And if you find none of them, then of course this patient is in cardiac arrest. You ask for help and then straight away you start the chest compression, which is the first step of the cardiopulmonary resuscitation. Now, AED is not available everywhere. Now, thankfully, in the community I'm living, so we have installed about 200 AEDs, and these AEDs are in different key locations. And we have done training, virtual training and face-to-face training. This training started during the period of COVID, but we managed to train all the individuals, about 3,000 plus individuals were trained for use of automated external defibrillator. So
Wow.
it's a big work again. Training again is not easy to get everybody together. Again, some people may have some fear because obviously the moment you mention heart stuff, so some people may not be comfortable from the very beginning. But I would again emphasize that we must educate the general public about cardiopulmonary resuscitation and automated external defibrillator.
Yeah, well, we're blessed here in the US that we have the external defibrillator. Pretty common, but it's not as common as I would want them. You probably have more of yours over there in Bahrain than here. Over here is just airports and maybe clinics and facilities that can afford it. And training as well causes a stigma as well. But the more people, I think, they are more familiar because usually when they have a person that collapsed and have to check that they're unconscious, they would call 911. But by the time 911 comes or the paramedics comes in, you have lost a lot of time, and AED could probably save and have delivered a shock, which is a very important tool, which is a very important facet of saving that heart. So training, education, promoting it to the public, and more people that are more confident buy in that it's not a scary thing. It's more to save lives.
Yeah, time is important. As I say, time is heart or heart muscle, and you have just 10 minutes to save a life. So as we all know that once the cardiac arrest happens, then the chances of survival decreases by 10% every minute. So imagine if 10 minutes are lost, then the chances of survival is approximately zero, none. So
Yeah.
that's again something we must advocate and teach the general public that time is very, very important. So they need to act fast. Regarding the AAD, in Bahrain, no, we are just trying to increase the awareness. There are certain localities we have the presence of automated external defibrillator, but not everywhere. So that is one of our goals to educate the general public. First of all, what AED is, automated external defibrillator. A lot of they don't know what it is, but they must also be aware of two things. One, where they can find one in times they're needed, and then how they can use it. So both are important.
Okay. Yeah, well, I am hearing a movement, doctor, that you already started. So hopefully it's going to be a worldwide because, like you said, an emphasized time is a huge issue. You may start a CPR, but if the heart needs a defibrillator because it's a different aberrant rhythm, you really need an AED versus just a CPR, which CPR helps, but every minute counts. Thank you.
Definitely.
I would love to emphasize that everywhere I go. Then it will be a movement that you have started. Everyone has been
Thank you.
trying.
Thank you. Thank you so much, Yvotte. Thank you.
Thank you. Well, we know that you are speaking from your passion, not just as a cardiologist, but also as a family member that is very familiar with the heart disease. And with your life as big example, you have started me on an exercise program after our last interview. You'd be like, okay, just 1 hour. And then like, yeah, he's right. I just have a 1 hour out of my 24 hours I could do exercise. So thank you for that.
Thank you. Thank you so much, Yvotte.
Yes, sir. Well, trying to be respectful of your time, I think you have done a marvelous job again in educating us and helping other people. And I love about the discussion is we can always share it with everyone. It's going to be timeless. Any last words, sir?
Yeah, the last word again, I would say to the audience who are listening to this conversation that heart health is important, and it is not, and your heart health is not your doctor's responsibility. It's not God's responsibility, but it's your responsibility. So please take care of your heart. Thank
Amen.
you.
What a beautiful thing to end with. Thank you, doctor, and so much. Precious is your time always, but thank you for sharing it with us. Appreciate you.
Always a pleasure, Yvotte, talking to you. Thank you very much for inviting me on your program.
Thank you. Appreciate you.
Thank you. Thank
Bye.
you. Bye-bye. Thank you.